Health Committee meeting for Wednesday, March the 5th to order. Ms. Alberton, if you would call roll.
Representative Lee?
Here.
Representative Lipscomb? Here. Representative Hall? Here. Representative Sorrells? Here. Representative Mooney? Representative Warren? Here. Representative Marcus? Here. Representative Gray? Here. Representative Rafferty? Here. Representative Paramore? Here. Representative Rigsby? Here. Representative Holk-Jones? Here. Representative DeBose? Representative Shiree? Here. Representative Brinyard? Here. You have a quorum. House Bill 330 by Representative Wood.
Thank you, Mr. Chairman, members of the committee. House Bill 330 is actually supported by ADM, and what this bill does, it changes the definition of lead-free, and it makes it the same as the federal government's. And the reason why they have to do this, so when they put in for grants, it's got to match it verbatim. So that's really all it does, just changes that definition.
All right, that sounds good. We probably get quite a bit of money from them.
Yeah, we do.
All right, we have a motion for Representative Hall and a second by Representative Brinyard. All those in favor by saying aye. Aye. Those against, nay. Bill passes.
Thank you, Mr. Chairman, members of the committee.
Okay.
House Bill 336 by Representative Hassell.
Thank the chair and the committee. HB 336, this bill would establish an interstate compact for respiratory care professionals. This will allow for more licensure and practice across state lines, also outlining the governance and enforcement and mechanism to ensure the compact effective operation.
This is a long bill, and does anyone have any questions? Okay. Have a move favor report by Representative Hall and a second by Representative Gray. Any comments? All those in favor of it by saying aye. Aye. Those against, nay. Very good.
Thank the committee and the chair.
Okay. We're on a roll. Y'all have done your homework, so good. Thank you.
House Bill 322 by Representative Holk-Jones.
Thank you, Mr. Chairman. We are on a roll, so I'll slow us down. I do have a sub. May I offer that now?
You may. And during your explanation, just go ahead and explain the sub.
Thank you, Mr. Chairman. I'm here today presenting the sub for HB 322. I have heard it said the best part about children is conception. Now, I don't know if that is true. I know children are pretty awesome, but I've also heard it said that after conception, the real fun begins. What I do know is after conception, reality sets in. So now that I have your attention, for many, postpartum depression is a reality. Over 9,000 moms across the state of Alabama suffer from postpartum depression. That's nearly 1 in 5 new mothers, significantly above the 1 in 7 national average. Postpartum depression is a mental health disorder. It is a disorder that is damaging to the mother's health. Untreated postpartum depression increases long-term health care costs due to emergency interventions and long-term mental health needs, as well as the damaging effects to the long-term development of her child. We must work to protect vulnerable children post-birth. We have a responsibility to set up future generations of Alabamians for success by ensuring that those moms are mentally and physically healthy. We can start these children off on the right foot from the very beginning. In summary, the legislation as addressed in this committee substitute addresses 2 primary issues. The bill requires the Alabama Department of Public Health to develop educational materials about postpartum depression. These materials would be available for anyone to access on the Alabama Department of Public Health website. Number 2, The bill requires physicians to assess moms for postpartum depression and refer them to treatment if medically appropriate. Had a good conversation this morning with a senator regarding this that said any doctor worth his salt is already doing that. And I said, you're right. Any State Farm agent is already doing the right thing. It's the middle of the road and below that we're trying to move the needle on to get those people that just aren't, those physicians or State Farm agents, whatever your profession is, to move the needle to make sure that discussion is being had. There is a physical note. Your physical note refers a lot to the expense of Medicaid. That has totally been taken out by this sub. I want to give a shout out to Medicaid for realizing the need for this to be already done. The discussion started with April 1st. They have already moved that to March 1st. So the Medicaid changes are already in place thanks to the doctors and the medical society, the hospital association, everyone working together. So your first paragraph on your physical note is no longer necessary. But we do have a responsibility to help some of our most vulnerable mothers. This crisis cannot wait. Mr. Chairman, any questions?
No, does everyone understand about the note here that it's taken away because it's actually been already taken place the 1st of March? So that's out of picture here. Anyone have any comments, questions? Yes, sir, Representative Mooney.
Obviously, you've introduced legislation that you've worked on, and it relates to a problem that you've foreseen in life in our state with especially, I would expect, mothers who don't have a lot of means to certainly do some of the things that others could do. However, was the response from the state Medicaid agency as a result of you introducing the bill?
I think it was a result of just good conversation of a lot of things that need to be discussed.
It's amazing to me that the agencies of government in the state of Alabama have to have legislation introduced in the House and the Senate in order to put them in a position that they do things to avoid having that legislation passed. Thank you so much.
Thank you.
Representative Shirey.
Is there a funding mechanism for ADPH to take care of the cost?
It goes through their budget.
They could stop some of their advertising.
Representative
Mr. Chairman.
Or who was it? Representative Rafferty?
So I'm sorry, I'm just now kind of reading, kind of going over the sub here. I know Michael Ann sent it out before, so I apologize for that. But curious, is this removing the requirement for the screening, or you're saying that the screening's already going to be put into place on March 1st?
No, the March 1st issue
Yes.
all has to do with Medicaid. There's a step process where you have to have 2 other drugs that do not work in order to go to a third, more expensive drug. That has totally been removed, and now it's up to the physician's discretion to choose. That's all in the Medicaid.
Okay, where the original
Portion
one
of it.
might have compelled it, the
Yes.
sub does not. Okay.
That makes sense. I'm not
it
sure I
does,
answered
yeah.
your first
Thank you for
question.
explaining that.
Thank you.
I like giving the doctors the opportunity to doctor rather than follow a just check the box.
Thank you. And that, I think, Representative Rafferty, is another one of your questions. Initially, the discussion was to have a questionnaire. And the thought was sometimes in a questionnaire, the patient might not be totally truthful. So we wanted to also have the discretion for the doctor to have a leading conversation, not just a black and white, are you depressed? So, but it does require that they have a conversation of some sort that they feel is medically appropriate.
And I totally agree with you on that. I know that people might feel a little bit more comfortable in that more casual conversation that they would have with the doctor during that evaluation.
Representative Warren.
Thank you. It kind of baffles me as we make these laws and give these stipulations that are we actually relaying this to the educational component of doctors? Because as I see it now, the medical schools are teaching more short-term patient time. My grandson just finished, got his MD this summer. And it's just that part of it is not really a part of the curriculum anymore. Really, the caring and the nurturing of patients is just to give a service and get out. So are we communicating to our educational facilities that this is something that needs to have some attention in this training?
Yes, ma'am. That's what the Medical Association, the Hospital Association, all is working on that with the higher ed.
Any other comments? Okay, we have a motion by Representative Lipscomb, second by Representative Gray, to accept the substitute. All those in favor by saying aye.
Aye.
Those against, nay. Substitute is adopted.
Thank you,
And
Mr. Chairman.
now we have to do now we have to motion for the bill as substitute. Representative Renyard. Have a motion. Second, Representative Hall. All those in favor by the bill as substituted by saying aye.
Aye.
Those against, nay. Bill passes.
Thank you, Mr. Chairman and committee.
Affirmation. Thank you.
House Bill 346 by Representative Lee.
Thank you. Representative Lipscomb, why don't you handle it from this point?
House Bill 346 by Chairman Lee. If you'd like to tell everybody about your bill, sir.
Okay. I received a call from a retired physician, or actually an email from a retired physician there in Dothan, and he volunteers. And in some of the requirement statute, we found out that there's a requirement they have to volunteer a maximum or minimum of 100 hours. And so, of course, I talked with the MASA, and they were willing quickly to make this change, but they found out it was through statute. And so what this will do will allow a retired physician, we'll change it, and there will be no minimums of hours or no maximum of hours. But there will be obviously continuing education and those things that are required there. But this just gives us the opportunity to use all that wisdom and knowledge in areas that really a lot of physicians may be too busy to work on in some of the free clinics and those things. So in a time of shortages for physicians, I think this is extremely important. And this just cleans it up where we can get more volunteers.
Thank you, Chairman. We have a question from Representative Rigsby.
I apologize, Mr. Chairman, I didn't get with you, but this is just a technical question. On page 3, line 77, in reading this last night, it says the applicant certifies on a form prescribed by the board that he or she is fully retired from the active practice of medicine. If they're retired from actively practicing, isn't volunteering still practicing? I know that's already in there, and I know I tend to be overly technical.
Yes, you are.
But it, and that's okay. But doesn't that just basically say that they're retiring from practicing medicine?
I
understand.
I am not an attorney. This went through several attorneys' eyes, and this is what they chose. Yes.
Yeah, if Nick can.
I think it's about their practice, retired practice.
Yes, and there's two different licenses, right? So you have an active full-time medical license, and then you have a retired license, this is adding toward that.
Okay, so essentially they're submitting or getting rid of their active practice license.
That is my understanding. I'm looking toward my colleague, and he says yes.
Okay, I just didn't want that to be an issue down the road and something come up and say, well, you said you're retired from practicing medicine, but yet you're volunteering and still practicing medicine. So even though it's not a paid job and you're volunteering, that practitioner is still practicing under a license. It's just a retiree license versus a active practitioner license.
Yes, sir.
Okay, thank you.
Yes, sir.
Thank you. We have a question from Representative Shirey.
That's more of a comment. These retired physicians have probably forgotten more about medicine than most of us will ever know. And I think we could absolutely rely on their expertise. So I would like to second Mooney's motion.
Do we have any other questions before the body? We have a motion for a favorable report from Representative Mooney and a second from Mr. Shirey. All those in favor, please say aye.
Aye.
Are there any opposed? Seeing none, favorable report.
All right, thank you. that concludes our